Hello everyone, this is Dr. Sayyam Sham and I am going to talk about the topic scalp. We usually think the skin from where our hair grows is the scalp. However, anatomically speaking, scalp constitutes the soft tissues covering our cranial vault or the skull. Now let us look at the extent of the scalp. Anteriorly, it starts at the superciliary arch and extends posteriorly till the superior nuchal line. Laterally, on each aspect, we have the superior temporal line, above which we have the scalp. Below the superior temporal line, we have the superficial temporal region. So, we can say that anything above the eyebrows and the ears consists the scalp. We will look at its structure now. The layers of scalp are pretty easy to memorize with the mnemonic SCALP, where S stands for skin, C for the connective tissue, A for aponeurosis, that is the aponeurosis of occipitofrontalis muscle, L for the loose areolar tissue, and P for pericranium. The first layer, skin, is thick and hairy, and it consists of a lot of sweat glands and sebaceous gland. The second layer, the connective tissue, connects the skin to the aponeurotic layer, and it also provides a proper medium for passage of vessels and nerves to the skin. And these vessels are very tightly adhered to this layer, so if there is a cut or a tear, there is profuse bleeding. The third layer is the aponeurotic layer of formed of the occipitofrontalis muscle. It is also called galea aponeurotica. The fourth layer is the loose areolar tissue, and it provides the passage for emissary veins which connect the extracranial veins to the intracranial venous sinuses. The last and the fifth layer is the pericranium, which is formed of the periosteum of the bones of the skull. However, it is loosely attached and only tightly attached to the sutures of the skull. The first three layers, the skin, connective tissue, and aponeurotic layer, are combined, also known as the layers, surgical layers of the scalp or scalp proper. As we had previously discussed, the area lying lateral to the scalp on both sides below the superior temporal line consists of the superficial temporal region. It is commonly known as the temple because tempus is Greek for time and graying of hair with age comes first in this area. This area is between the superior temporal line and the zygomatic arch. It consists of six layers: skin, superficial fascia. These first two layers are common to both this area and the scalp. The third layer is the thin extension of epicranial aponeurosis. The fourth one is the temporal fascia. Fifth one is the temporal muscles. And the sixth one is the pericranium, which was also present in the scalp. Coming to the blood supply, before we go any further, I just want you to understand that anatomy is all about diagrams. If you can understand the diagrams correctly and can imagine the structures in your head, the theory becomes very simple. Let's look at the diagram first. The anterior-most aspect, we have the supraorbital artery and the supratrochlear arteries. We can remember this as they are related to the eye. Near the ear, we have the superficial temporal artery, which is related to the temporal lobe of the brain, and the posterior auricular artery, which is behind the ear, and the occipital artery, which is the fifth artery supplying the scalp, which is related to the occipital lobe of the brain. Now, the first two arteries, the supratrochlear and the supraorbital, are branches of ophthalmic artery, which are in turn branches of internal carotid artery. And the other three arteries are directly a branch of external carotid artery. So we can conclude that most of the scalp is supplied by internal carotid and external carotid arteries together. Similarly, looking at the venous drainage, the names of the veins are similar to the arteries. For example, we have the supraorbital and the supratrochlear veins, which combine to form the angular vein here, which in turn forms the facial vein. Then the superficial temporal vein, combines with the maxillary vein which comes from the parotid gland and combines to form the retromandibular vein. Now this retromandibular vein has two divisions, the anterior division and the posterior division. The anterior division combines with the facial vein here and it forms the common facial vein which drains into the internal jugular vein, whereas the posterior division directly combines with the posterior auricular vein and forms the external jugular vein which drains into the subclavian vein. The lymphatic drainage is relatively simpler. It can be divided into the anterior part and the posterior part. The anterior part is drained by preauricular and the parotid lymph nodes, whereas the posterior part we have the posterior auricular or the mastoid and the occipital lymph nodes. Similarly, we look at the nerve supply. The scalp is innervated by 10 nerves on each side, 5 on the anterior part and 5 on the posterior part. Out of these, 8 are the sensory nerves and 2 of them are motor nerves. The motor nerves are required for the muscles of the scalp, which are branches of the facial nerve. On the anterior aspect, we have the temporal branch of facial nerve, and on the posterior aspect, we have the posterior auricular nerve. The sensory nerves include the supratrochlear nerve and the supraorbital nerve, which are related to the eye, the zygomaticotemporal nerve, which is related to the zygomaticotemporal bone, the auriculotemporal nerve, which is related to the temporal bone and the ear. On the posterior aspect, we have the great auricular nerve and three occipital nerves, the lesser occipital nerve, greater occipital nerve, and the third occipital nerve. All of these four nerves on the posterior aspect are branches of the cervical plexus. Looking at the clinical aspects of the scalp, we have the first three layers are also known as the scalp proper or the surgical layers of the scalp, as we had previously discussed. The scalp is abundantly vascularized and thus a wound will bleed profusely. Thus it should be stitched in position. In cases of life-threatening hemorrhage, first aid, first aid measure of encircling a cotton tightly around the ears and eyebrows should be done. In infants, the scalp veins can be easily seen and can be used as a route of intravenous infusion. In cases of internal bleeding, the scalp may get swollen and blood may extend anteriorly into the eyelids, causing black eye. An area called the dangerous area of scalp is the layer of loose areolar tissue with the emissary veins. This is because any infection of the scalp can spread into the venous sinuses through these emissary veins. Due to the abundance of sebaceous glands, the scalp is also an area with a high chance of sebaceous cysts. Also, because of the spread of blood, compression of brain cannot happen, and thus this layer is also called the safety layer. I hope you liked and enjoyed the video. Please give your suggestions in the comment box below and help us improve this channel. Thank you for watching.